Hello, my name is Lori Marion. I am the nurse in the office as well as the IVF coordinator. I like to refer to myself as your tour guide or cruise director through the IVF process. I will be meeting with each of you individually to go over in depth how to use your medications, why you're using your medications, but please refer to these videos for any refreshers you may need along the way. And as always, please feel free to contact myself or Dr. Yasinkaya with any questions throughout the entire process. The medication we're going to be discussing now is called either Ganirelix for some patients or Cetrotide for others. These medications are the exact same medication, they're just manufactured by two different drug companies. Their purpose is exactly the same, so please refer to whichever brand your pharmacy sent to you for instructions. Number one, Ganirelix is very simple. It is a prefilled syringe. When you open the box, you simply take it out of the packaging. When you hold the syringe up, you'll notice there's an air bubble in the syringe. Simply flip the syringe. It will float the air bubble to the top of the syringe. Push out the air to the top. Take the cap off. And this injection will go in your lower abdomen. If you will refer to figure 5, in the lower part of your abdomen, if you'll draw an imaginary line across your belly button, anywhere in the lower abdomen will be fine to do this injection. And in referring to figure 4, you'll notice that the patient pinches up the skin on their abdomen and injects the needle directly into the skin that has been pinched up. This needle is very small, so inject the length of the needle fully into the abdomen, inject the solution, pull the needle straight out, and that will be complete. This shot will be done once a day, either morning or evenings, as prescribed by the doctor to do. The second version of this medication that you may receive is called Cetrotide. Unlike the Ganirelix that we just demonstrated, you will actually have to mix this version. When opening the box, there will be a self-contained packet that includes a prefilled syringe of liquid, several needles, and a vial of powder. The powder is the actual medication. When opening the box, you will attach the larger of the two needles to the prefilled syringe just by screwing it on. You will then take this needle and inject all of the prefilled syringe of liquid into the powder vial. At this point, the powder should become almost completely liquid immediately, but swirl it around a few times just to make sure that this happens. Once everything has been diluted and is now in a liquid form, you will take that same needle and syringe and draw out everything in the vial. Do this by holding the vial upside down at eye level and have the tip of the needle just barely in the vial so you can see as the water line drops that the needle is fully submerged in the liquid at all times. When you're done, turn the vial over. Make sure that the liquid is completely out of the vial. At this point, we do not want to use this large needle for an injection. That would hurt. So you will switch to the second needle in the package, which is the smaller of the two needles, for the injection. This injection will go just as I described with the Ganirelix a moment ago, in the lower abdomen, anywhere below the belly button. According to figure 4 here, you'll pinch up the skin, inject the needle completely into the abdomen, inject all of the liquid, pull the needle out, and then the shot is complete. You can at that point put the used needle into your needle box.